Good evening, good afternoon, and good morning. This is the 1476th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. ABHISHEK BANERJEE from dental side. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over. That's a Hindi session from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and 9:30 to 10:30 a local language session in Malayalam. Today in Kerala we are celebrating the Onam, so I wish you all Onam greetings, and let us introduce the guest of the day. Dr. Abhishek Banerjee, MDS, is working as an associate professor and postgraduate guide, Department of Maxillofacial Pathology, Awadh Dental College and Hospital, Jamshedpur, Jharkhand. So it's a very, very important thing because a doctor from dental side can speak a lot of things because we, as homeopaths, to deal with different situations in oral conditions, and we are very happy to have such guests coming over here and delivering beautiful sessions. And we have a lot of presentation earlier from different doctors from the other side also. And Dr. Abhishek Banerjee is talking about common encountered oral lesions and diagnosis. That's a very, very important thing, and that will definitely help us to get what is what, and that will enable us to prescribe easily. So we proudly welcome Dr. Abhishek Banerjee to this session. Welcome, Doctor.
Thank you, Dr. Dhanesh sir, and all the senior members, my peers from the Fraternity of Homeopathy. Before starting on with the presentation, I would like to mention that we are practicing a different system of medicine. We do prescribe a different drugs and all together. But yes, there exists a very parallel medicine practice and a very important and age-old practice of medicine, that is homeopathy. We are totally unknown about that, though we seek treatment from different doctors. And personally, uh, to this session, I have been guided and I have been recommended by Dr. Partho Chakraborty from Durgapur. He's a professor par excellence, and welcome you all to this session. And I will share my screen.
Yes, sir.
Okay. Thank you. So before starting on with this, we know a correct diagnosis is a three-fourth of the remedy. And it was said by our father of the nation, Mahatma Gandhi. And the most important from the founder of homeopathy, Sir Hahnemann, the highest ideal of the cure is a speedy, gentle, and enduring restoration of the health by the most trustworthy and the least harmful way. So the most speedy and the gentle, these two words, how we can know that we can only deliver a speedy and a gentle treatment if our diagnosis is correct. And hence, my topic of presentation for today is commonly encountered oral lesions. Myself, Dr. Abhishek Banerjee, I'm holding the capacities of an associate professor and a PG guide at the postgraduate department of maxillofacial pathology at our dental college, Jamshedpur. I'm also associated with the research faculty at universities of Airlangga, Department of Oral Pathology, Indonesia. So when we actually consider as the oral diagnosis and oral pathology, we always see, हम लोग हमेशा देखते रहते हैं कि the mouth is the portal of entry of any disease, which is the open cavity to the atmosphere, but it is ignored. So we have all cases of edentulicity, like we sometimes we have neglected dental caries, we have mobile teeth, loose teeth, we don't sometimes we even don't have teeth, but we always tend to ignore that because that is a oral cavity. We give more importance to our overall health compared to the oral cavity, but we should always prioritize oral cavity in a very first and foremost place, because it is the start of the day starts with the oral cavity, like the brushing, our eating, our first digestion, and everything, it starts with the oral cavity. So we need for this interdisciplinary approach, that is the referral to the dentist, special referral, medical referral to general practitioners, Ayurveda, homeopathy, yoga, and Unani, and other faculties of medicine, dermatology, ENT, and even rural medical practitioners. Now, when it comes from the clinic, we see that what is the chief complaint. When the patient comes to your clinic, the patient tells, "This is my chief complaint," when it is the oral lesion. And sometimes they come for some other complaint where the oral lesion is not the priority, but they come to you with the complaint of something else. But the root cause is from the oral cavity. So both the situations we have to deal as a practitioner. Now, when we have something related to the dental or the oral related, we have to be smart to earn the confidence, because not all the patients are motivated to go to a specialist for oral care. So when it comes to you, you also have to treat them. But how to treat them? You have to gain the confidence, because already the ignorance at is in a prime level. Lesions are most important, if may or may not be practiced, but for the patient. Need basis, like take up the case of the lesion for the next visit also. If the patient is not motivated for the oral case, you have to take it for the next visit also. The clinical aspects that goes on with the thorough examination involves the history taking, communication, photography with consent, well documentation, and also some use of the fluoritons like histopathology and the small skin test, where we need the patient to refer for the biopsy, because biopsy is sometimes the key to the diagnosis. So we have to go through a thorough history taking, that we have already seen the homeopath practitioners, they get a very elaborate history taking, things are very elaborate. So communication with the patient should be convinced that what has actually happened to them. And photography means sometimes what we have to do, we have to photograph the case, and we have to see how the case is resolving. Is it the same? Because sometimes we see a lot of cases per day basis, we won't remember how the case has resolved over the period of 15 days. Is it a special case or not? So in this kind of cases, we have to take a photography, but with an informed consent from the patient. When it is, this is a small cartoon which shows that patients are sometimes scared of the word biopsy. So there we have to tell the patient that we
No,
have,
hello, hello, doctor.
yes,
This slide is not moving. First
is
slide
it
is there. The first slide is there.
okay, okay, okay.
Okay, now.
Uh, just a minute.
Now I am just going to send that small
Just a minute, please.
green picture.
Green picture you can see, right?
Yes, yes. Which
Just
side you are speaking?
is it okay?
Okay.
Is it moving right now?
And yes, yes, yes. It's moving. How to
Oh,
explain?
yes, yes. Now, how to explain? Because there are some lesions in the oral cavity which are not cancer, but the patient has come with the fear that they may develop cancer. So there is some stages before malignancy, like before the cancer, that is known as dysplasia. Dysplasia is nothing but it is a disturbance in the oral mucosa. Oral mucosa is having two phases. two stages. That is, the one is the epithelium and one is the connective tissue. So when mostly this particular oral mucosal lesions, mostly the disturbance lies in the epithelium. And when it crosses the border of the epithelium and goes into the connective tissue, there starts the malignancy or the cancer. So we have to explain the patient well that which stage it is. Like patients sometimes come to you, sir, have we already developed? हम लोग को कैंसर क्या already हो चुका है कि नहीं? So you have to explain, no, you are in the precancerous stages. So there are a lot of precancerous stages which I will be dealing in this particular presentation, and then it follows by the malignancy. So there should be clinical aids, there should be stains, there should be cytological tools, diagnostic tools, ideal storage medium. Sometimes what happens that we get a sample, but we do not have an ideal storage medium. So formalin is a very ideal storage medium to store the sample. And sometimes the use of the software for the documentation. What we have used, we are regularly using WhatsApp. So thing is like if a patient comes to us with a particular lesion, so we can clinically document that case and we can refer it, we can send it to our colleague to get a better advice from that what need to be done. So this is something known as well scope. This is a non-invasive a light which help us to determine whether it is abnormal and whether it is normal. And irrespective of the different practice of the allopathy or homeopathy or Ayush, these are specifically designed for knowing the abnormal sites in the oral cavity. And that we can picturize and we can educate the patient so that the patient don't get lost within the particular disease or don't get lost in the entire that they don't know what to be done. So they know what is the abnormality and they know what is the normality. So this is otherwise known as visually enhanced lesion scope, and this uses the fluorescence light for knowing the abnormal and the normal tissues. This is one more stain that we can do in our clinic if we can keep an assistant to educate them that which is normal and which is abnormal. So in this particular area, what we can see that there is a abnormal area which has taken up the most stain, and these are prettily the disturbed area other than these sites where the disturbing element is still spreading. These are the cytological scraped area where we can also send it to our lab, because homeopathy is also having an investigation portion there where we can help this particular patient, that the patient should not get think that what I have where I have gone, they have not done any diagnostics. So these are the very non-invasive chairside diagnosis that we can even do, because we have to give the best to our patients. So we should not look what is wrong, because even we allopathy, we sometimes we have to refer the cases to our homeopathy practitioner for few things that where they can treat better, for neural lesions, for neural disorders, and also better why we cannot accept the best thing from which we are not even practicing. So this particular brush, it goes to the epithelium and takes up the cells, and this goes for the this are cytological specimen, and that goes to the lab. Now here comes the discussion of this painful ulcers. This painful ulcers, what we can see is this raw area followed by a normal-ish area. So these are all vesiculobullous lesion like the pemphigus, pemphigoid. So these are autoimmune lesions where the body's own cells identify our own body cells as some enemy, and they start attacking, and even the healing is little delayed. That's why patients feel extremely irritated, patients feel extremely itching and burning sensation while having any kind of spicy food. So this is the main thing, how we can communicate with the pathologist. There are some vascular lesions, what we can see in particular in this tongue. These are all vascular lesions. So how we will know that this is a vascular lesion? We have to press the lesion with the bidigital way, and we have to look that whether it is pulsating or not. Pulsating means there is a particular blood supply, and where there are blood supply, that means it is this lesion and constantly getting nourished by this, and there is a particular area where it is showing this echogenicity and this particular feeder vessels we have to look, and we have to know the diagnosis of this vascular lesion. This is again a pulsating lesion, and we have to know that whether this is a vascular lesion and this is a vascular, both are supplied by the blood vessels. But thing is like these are from the feeder vessel. So we cannot do anything for that. So definitely I feel that homeopathy practice of medicine do have some remedial cure for this kind of lesion. But this kind of lesion, it do not go for a remission, because this is generally from periodontal remnant cells, and it comes through the poor oral hygiene, and this is the case of a pyogenic granuloma that need to be completely excised out. But this cannot be excised in a local setup. Probably it can go for a remission, like how the different chemicals and different drugs are there, so it will exist in your practice also. That I have to know more to make me more knowledgeable that how to treat about this. But these are the pulsating lesions that are high vascular flow or low vascular flow, and this is how we can distinguish between which has to go for surgical and which can go for medicinal way of management. This is this is one understanding of the histopathology report that is also very important. I have told in my previous slides also that knowing dysplasia, that is a disturbance of the epithelium, which is very important. Borderline case, the dysplasia and the malignancy, which cases are borderline, and even if it is malignant, which are curable malignancy and which are non-curable malignancies. And we have to know about the biology of the lesion. Every lesion is different in its own perspective. So we have to know the nature of this lesion. Now, this is a case which comes with the tobacco smoking and a white patch and a non-scrapable crack mud appearance. And we have to particularly look into the word that is the habit associated. And this is what it is like known as leukoplakia. So leukoplakia is a clinical diagnosis. Leuko means white and plakia means a patch which is not scrapable. But if it is scrapable, it goes for the candidiasis or any kind of a fungal lesion. So we have to grade this as per the dysplastic potential. Now, next case is again a very similar looking, but we have to stretch the mucosa. If on stretching the mucosa it disappears, that means it is leukoedema, and it needs no treatment at all. It is a totally a non-precancerous lesion, and patient has to be told that patient should not worry about that. These are the cases which also comes to your practice on a regular basis. Patient who are diabetic, patient who are into stress, females who have a hormonal downsurge after 45 years, with this white stripe burning sensation in this gum region. And these are a typical classification of oral lichen planus. And I think oral lichen planus is a burning topic everywhere, that every fraternity of medicine do practice a different mode of practice of this oral lichen planus. And very frankly speaking, in allopathy, this oral lichen planus has no permanent cure. There is no proper treatment protocol also laid down, that we do give steroids and multiple other things. But I think that there must be some remedial cure that is more helpful for the patient, because this kind of patients develops a lot of side effects from the drugs. This is a case which I was talking about, a white patch dot that we can see in the side, but this is a totally a scrapable lesion. So we have to put the patient into the antifungal. We can see how the patient has a poor oral hygiene also. That leads to the development of this. And even we can see a depapillation of the tongue. That means there are some nutritional deficiencies that we can fulfill in this particular patient. So this is a case of candidiasis. Next case is drug eruptions, where these are all my personal cases, and pictures speaks a lot of words. That's why I'm speaking more and showing you representative pictures which you can correlate with your day-to-day practice. So these are the many times what happens. The patient comes with this kind of this thing. Patient comes this kind of lesions where they are already susceptible to a different drug. They have already taken a different drug. Probably they are taking some antibiotics and something, and they develop this kind of rashes. And they comes to your practice for seeking homeopathic medical care. There you have to reascertain the patient that this is perfectly okay and it is going to go off with your particular drugs. But these are not something to be worried about long. But yes, for the local acute exacerbations, we have to manage this particular lesions. So this is how we have to go for the history of the case. These are not a long standing case, but these are a very short and acute eruptions of this particular ulcers. Probably the patient will tell within 3 to 4 days, or last night I have taken some antibiotic or some change of drugs that has happened to this. This is a case which need to be dealt with little care. This is a case of erythroleukoplakia. Erythro means red, that is the red color over here, and the leukoplakia means a whitish patch over here. So this red color area is the most dangerous area which can go for a malignant transformation. And I have adopted this particular picture from Dr. Hatim Ahmed from Egypt, and this was a very beautiful representation of this. So this particular area need to be biopsied, or we can go for a medicinal management at the first, because patient directly don't go for a biopsy on the first hand. So we have to keep on monitoring that whether this lesion is resolved or not. And we can also see a simultaneous changes in the lateral border of the tongue. That means this particular area is showing a lot of abnormality. So this we have to go for a frequent follow-up. Next particular, this is a radiation mucositis. Patient has gone for a depapillation of the tongue, and you have to ask the history that what has happened. So the patient will tell that patient has recently gone for a radiation and now there is a burning sensation. So this will take a lot of time with the vitamin supplements and other things that leads to the proper cure. This is one case which frequently it comes to our clinic, and so do I expect it also comes to your clinic. This is the posterior most area of the spoliate papillitis, and this causes the inflammation due to its no poor oral hygiene. Like the hygienicity cannot be maintained in that particular way. So this is particularly area that need antifungal treatment with some kind of local anesthetic gel that patient can take, and patient can go for a normal diet. So vitamin D also helps in sometimes vitamin D, vitamin B12 supplements also helps in this. Now this is a case of an electric burn. This is little special, but this is not commonly encountered. So this also looks like a very stereotypical fibrosed area, but this is due to an electric burn. This is a food burn which has come to the clinic, generally in the palate, when the patients come with a cheese, comes with a history of having very hot food, and usually it gets stuck to the palate because stuck palate has a very low serous secretion from that area. So the lubrication is very less over there, salivation is very less. So the food usually gets stuck over that particular area. Now we have to know about the growth, that is the ulceroproliferative growth and even normal growth. So this is kind of malignancy, and this is kind of still it is localized. So the prognosis will be pretty good. This is one more case which leads to the, this is due to the friction with the teeth. And this is very common. Absolutely do not need any particular treatment as such, but yes, you have to give a dentist referral so that the corona or this crown can be grinded off little bit so that it becomes smooth and there is no lesion per se. This is a squamous papilloma. This is due to the human papilloma virus HPV 6, 11, 42. So this is need to be surgically removed, and we have to tell the patient that this is a very locally recurrent case because HPV lies in the genomic DNA, and it has a predilection in the blood also, so it can happen anywhere in the body. So we have to inform the patient about that. These are the different malignancy forms that we can actually see. That is in the buccal mucosa, in the tongue. This is all due to the different forms of smoking that has happened or tobacco consumption. So these things are specifically, I feel it needs a multi-speciality interdisciplinary approach. Now, this is a history of fever, post-extraction, and developments of such lesion. And this is how the presentation is also something like that. Present also like this, and this is kind of a herpetic neuralgia, where with the words of herpes zoster of the trigeminal nerve by clinical and hematological investigation also it is proved, and it needs a local remedial. So it is usually we have tried with our medicinal management, and it's post-operative herpes zoster infection of trigeminal nerve. So definitely these all things are medicinally cured. So do your specialty also have this kind of medicinal approach? These are also different viral lesions, not to be confused with some malignancy, because history is a very important. These are all acute incidents of this lesion. So this is completely almost cured and there is no recurrence. This is again a mimicking lesion because this usually the mucosal surfaces stick to each other, and this is also some aphthous, minus aphthous ulcer. Now this is a case with the tooth is absolutely normal looking, but on biopsy it was a well differentiated squamous cell carcinoma. So sometimes a long standing lesion which are there but it is not healing need to be dealt with an interdisciplinary approach. Now, this is a case of your specialty also, patient with a history of arthritis, diabetes, and signs of deformed fingers, and also develops this mucosal patches. So this is generally it happens. That is what I was talking about, the side effects. So this is not supposed to happen, but this is due to the drugs which the patient is taking on a steroids or in a regular basis. So the drug, so this was again a recent image that was developed after healing also, and this was biopsied for a pemphigus, and this was a drug-induced pemphigus or a provisional diagnosis of Behçet syndrome was done, and the features were also looked for the skin and the eye. This is a case of a small elevation, and this was a hydatid cyst. People who are having more of a cattle, people from different having different food habits of non-vegetarian diets, this can eventually happen. And sometimes these are diagnosed as the oral hydatid cyst. It was the 12th reported case in a PubMed journal, and second opinion was also taken. But the main thing is like hydatid cyst of the oral cavity can also be fatal if it goes to some deeper organs, and systemic spread is very devastating. This is a lateral tongue case. This is due to a sharp edge of the tooth, we can see. And on biopsy, it was all normal. So this was a traumatic ulcerative granuloma with stromal eosinophilia, that is TUGSE. So my intention is to say that all lesions like this, fiery looking, are not cancer. We have to go for an investigation for this, and hence we will know. So this is one more ulcerative area, bleeding on provocation, but the key for everything is like for this case was loss of weight over the last few months. And this was or case of oral carcinoma cariculatum. This is a very slowly progressive, unlike oral squamous cell carcinoma regular, and just little less aggressive compared to varicose carcinoma. This is a case which is again proliferative, and it is from the side of the tongue. And yes, patient was having a crown which was getting dislodged. So it was again a CT was done, and we can see how deeply it has invaded the bone. It is already a tumor 4 T4 stage as per CAP, and it was a de novo primary intraosseous carcinoma. And we can see how the keratinaceous material is coming out even after the surgery. So we have to look for the diagnosis, and this is a keratinizing type of primary intraosseous carcinoma. And this is a very case 7. This is a very small girl with a mobile tooth, absolutely mobile tooth, no swelling, nothing, but a very slight swelling on the face. So we have to go for a radiograph, because normally when there is a shaky or a loose tooth, we usually pluck it without seeing any investigation. But this was a case of a amyloblastoma. This is a huge tumor, aggressive tumor, locally aggressive tumor, and patient has to go for a very conservative surgical management because of the age. And this was a case of a mobility of the anterior dentovalvular segment, and the patient has come with a piece of chunk of this bone, and this was a post-COVID presentation. And when we find the CBCT, it was gone, eroded. The tooth were all floating. And this was a post-COVID again presentation with a non-diabetic, and we can see how this particular area has eroded. So this kind of cases, what I'm suggesting is like an investigation, a radiograph, a OPG. This is particularly we can go for a CBCT, cone beam computed tomography. This is a very recent advancement in the field of dentistry that all can avail. We can get a three-dimensional image with a CD, and we can go for this particular investigation, and we can guide the patient if not treated. Many times we cannot treat many cases, but we can guide patient. That is also a part of our practice, not to misguide anyone. So these are the cases, and when we actually go for the histopathology, we can see a lot of bacterial colonies, and this was a microbial manifestations we can see. So this was a steroid-induced osteoporosis with mucormycosis as a provisional diagnosis. This was again a case, a loose tooth. Patient with loose tooth. Even in our practice also, whenever there is a loose tooth, we becomes very happy. We just need a few seconds to pluck out the tooth, but we need to go for a X-ray. See, the doctor, local doctor, he has no fault. He has taken a small X-ray, seen a bone loss, plucked out the tooth. Next 7 days, the patient has gone for a very big, huge swelling of the maxilla, and we can see such big lesions in in the max upper jaw. When we have actually gone for the biopsy, we could see a lot of bone malignancy, lot of dysplastic cells, pleomorphic cells, and it was diagnosed as a spindle cell variant of osteosarcoma. And secondary opinion was taken from Maulana Azad Dental College, New Delhi. So this is what I want to tell. Even patient comes to you with a different kind of gum swelling, so not to take any gum swelling lightly. And not all gum swelling can be treated by antibiotics. So probably the giving antibiotics for those particular cases without getting a investigation means pushing the patient more towards the deathbed. So we have to go for investigation. Now, this is a case of again a long-term diabetes, no habit, very educated female also. Lesions since 3 to 4 years, non-curable. Numerous medications failed in resolving. So this is the case how it appeared. And trust me, there was no habit. Patient's oral hygiene is also very good. Patient has tried for different systems of medications, but it has not gone. And on biopsy, it was tried to be a oral proliferative verrucous leukoplakia. This is particular variant of leukoplakia which has a genetic predisposition. So this genetic predisposition has a very high recurrence rate followed by a very high malignant transformation. So it goes with the from the hyperkeratosis to the verrucous carcinoma. It ranges in between these two diagnoses, and we need a very ideal diagnosis for this kind of cases, though it is very rare. So the take home points will be like dentistry starts and completes only with the correct diagnosis, and understanding pathology and addressing to the problem will lead to the good treatment outcome. Pathology is the basis of any disease, and so understanding is very crucial. A person who gives importance to the diagnosis is a successful doctor. And I thank everything to my alma mater from where I have done my undergraduation and post graduation, the teachers who have shaped my career. And thank you so much. You can visit my page and you can even contact me. You can mail me at this in case of any doubt. We are available in WhatsApp also in both the numbers. And this is a particular image which I have taken from the web. This is very interesting. These are the northern lights. Like to feel this, we must visit this place. We cannot exactly grasp the beauty by just seeing pictures. So is your specialty homeopathy. It's having its own beauty. So the more interaction between interdisciplinary will fetch the more better results, and we can help out the patients in a more better way if we are all like together and discuss and interacting. Thank you so much to the International Forum for Promoting Homeopathy for giving me this opportunity. And I would specifically thank Dr. Dhanesh for handling everything so meticulously. And I also thank Professor Dr. Partho Chakraborty for giving me this opportunity to speak in his fraternity without any delay. Thank you so much. And I'm just over to the host for any questions.
Doctor, it's a very good presentation. And those who want to communicate with the doctor may please raise your hand so that you can unmute and speak. Is Dr. Manoj?
Thank you, Dr. Thank you, Dr. Tanesh. Dr. Abhishek Banerjee. It's a nice
Thank you.
presentation, very precise one, very professional one. And I think we need a lot of medication in such cases, and definitely homeopathy is a number one medicine which is applicable to all these cases. Recently in Kerala, there is a medical dental college. They are about to start a dentistry department in the dental college. We have a lot of medicines without any adverse reactions or side effects. We can
Yes.
take it. But what is more needed is support from the people like you, highly qualified persons are needed to provide the assistance as well as
Yes,
proper information.
actually, I have a few of my homeopathy patients, practitioners as patients. I feel that if every then homeopathy college have a faculty of dentistry, I think there we can talk and interact more on diseases and management medicinally. What we are going for surgically many times, it may be patient do not want that surgery every time. So this is what we can actually do by more of interaction between and crosstalks between the different two systems of medicine.
Yes, definitely. Moreover, the recurrence can be prevented. That is the most advantage.
Yes,
The often
yes,
happening, and we can help the patient definitely with surgery, but to
yes,
prevent the recurrence, definitely the medicine is.
yes, yes. Very true.
Your attitude is highly positive, and I think the participants must listen this, and also the Central Council or National Homeopathy Commission must take initiative in such a direction so that common man will be benefited with the science, the
Yes,
medicine. all are doing with one intention to cure the patient. There is no
Yes.
difference on that. Okay, thank you. If anybody like to participate, please raise your hand. You can clear your doubts with Dr. ABHISHEK Banerjee is there. Please. Dr. Tanesh.
We have here Dr. Arpan Shah over here. He's one of my very guiding senior. So
Yeah.
what I can see over here, he is also an oral pathologist par excellence. So thank you so much, sir, for attending this session. I think I have not committed any mistakes over here. Thank you so much. And actually, this is very good if we all come in one platform and we can discuss. There are a lot of things we can actually know which are totally unknown to us.
Yes. Definitely. Last day we have a cardiologist session, Dr. Jayapal. He was discussing about the possibility of this artificial intelligence in the field of medicine. I think that is also a major area where dentistry can be very effectively because of the precision with this the robotic surgery all things.
Yes, yes.
Dr. Arpan Shah, are you there? Sir, please unmute, sir. Could you please make some comments?
Hello.
Yes, sir, please.
Yeah. Uh, Dr. Abhishek, it was really a very good, very nice presentation, recapitulating all the day-to-day encountered lesions of oral pathology, oral lesions. And I just want to put one question over here that I have heard particularly for oral lichen planus, that homeopathic treatment is effective. If someone from the fraternity of homeopathy can take up this question and elaborate shortly on the treatment aspect of such kind of skin lesions, because oral lichen planus is such a lesion which is very, very commonly encountered, and it is very refractory to treatment. It keeps on coming back even after giving allopathy treatment, steroid sparing agents also. And I know that homeopathy has a certain role in treating such lesions. So it would be great if anyone can discuss this.
Yes, definitely, sir, because our approach is based upon the symptoms of the individual. We can manage almost all cases. Moreover, by studying this pathology in depth, definitely, and also we can give medicines to prevent the constitutional medicines. That means after taking the total symptoms of the patient, the mental symptoms, the physical symptoms, all these things together. Otherwise, we can say the recent terms, tailoring the case. That's the most important thing in homeopathy, what we are doing, the individualist medicine or the personalist medicine. That medicines we can almost complete the process. Moreover, the diet and regimen, homeopathy is very much concerned about the dietary factors, the regimen of the patient. That is also very important. As you know, that in case of this dentistry, that is also very much important. Moreover, the recent food habits of the persons are always taking this artificial diet, then the alcohol, the beverage things, then the smoking, all these things are further creating problems. So with a comprehensive step with containing all these things, we can reach this case. I hope so, sir. Dr. Tanesh, are you there?
Yes, sir.
Yes. What is your comment on the treatment of this lichen planus, Dr. Tanesh?
Yes, definitely we can manage those cases with the homeopathic medicine. 1 minute.
Dr. Tanesh is using 2 devices. Yes, please, Dr. Tanesh.
Okay. Sir, what was the question, sir?
What about the prospects or the possibilities of treating this lichen planus with homeopathy medicines, and share your experience? That is Dr. Arpan Shah was asked.
Cannot say definitely, whatever be the case, what we require is the proper case taking, and only after proper case taking, then we can choose the remedy accordingly. For example, uh, it whatever be the reason, there are some certain reason behind every illness. One need to find out what was the reason for that particular patient. That's what we have to proceed. Then we can proceed with our constitutional medicine. And of course, at times we can go ahead with the pathological prescription also. That's what I would like to add to this question. Dr. Abhishek, what's your opinion of tooth extraction in children? Whether you allow, you prefer to do this root canal therapy, or whether
Yes.
you
Yes, actually depends upon the age and depends upon the time of eruption and the duration of the tooth. Like for example, every tooth is supposed to be for a definite duration. And before that duration, if that particular tooth is getting caries or something like that, there are different pulp therapies. So there are different kind of pulp therapies we can do to protect the tooth. Because if we protect the tooth in children, that tooth is particularly acting as a space maintainer for the permanent tooth to come. But if we are extracting the tooth, primary tooth, before the permanent tooth is coming, so the adjacent permanent tooth which has already erupted, which it will push and majorly drift into that particular area. So that the tooth which is supposed to come in that particular position, it will come in some other malpost areas. So treating the tooth, looking into the condition is very important. And we need to always think of conservative treatment rather than removing or tooth extraction. It should be the last option.
Yes, yes, exactly. That's what that's why I asked a question, because people believe that, oh, this is a simple thing that we can remove the teeth first. What is the purpose of doing this kind of root canal for these children? Because
Yeah.
they may develop some tooth soon after this removal, the extraction of this teeth. And this is the common thought going on among
Yes.
people. And we used to get patients, they are coming back to us and saying that, oh, that doctor advised for root canal. Then how, what is the purpose of that? He is trying to collect money out of it, like that.
Yeah. Yeah.
But this is the common thing that we noted in our day-to-day practice. Then we used to advise that, oh, it is better to protect the teeth first. You can take homeopathic medicine first, and along with, if you do this root canal, definitely you can go ahead with the perfection. And
Yeah.
as and when the tooth comes out, naturally this thing will go out.
Go off. Correct.
Am
Correct.
I right?
Yeah,
Uh,
correct.
wh- wh-
Absolutely correct.
Whether it do any obstruction in
No,
coming.
no, no. It does not give any obstruction. But that's what we have to look for particular. If a particular permanent tooth has to come at suppose 10.5 years, and the deciduous tooth is already hindering in the same position, if it is not falling or exfoliating, we have to remove that primary tooth, because to get the permanent tooth into that position, because permanent tooth we have to give a more importance at that particular point of time.
Then we have seen lot of cases coming out with offensive order from mouth. When we look into the case, we can find that there is severe infection in the gums, as well
Yes,
as the root of the teeth also. Uh,
yes, yes. That that is like gingivitis and periodontitis, gum issues. There we have to go advise a patient about going for a scaling, and simultaneously some homeopathy toothpaste is there. I have seen that the homeopathy doctors keep prescribing, and that is giving pretty good results. Patients are pretty happy with that, and followed by if they go for a scaling, I think it will go giving more better results.
Yes, exactly. By in between, if you administer homeopathic medicine that way, because if the order is so offensive, And so Panchin, then we can give a creosotum,
Correct.
one of the best remedy for that. And of course, another remedy coming out there is Mexol. Mexol is also will give a lot of good. Along with we can give calcarea force and calcarea floor. These are the
Correct.
homeopathic biochemic remedies that help the tooth to come out easily and with to cure those conditions also.
Correct. Correct, sir.
Some people used to advise some petrolaca tincture to gargle. I
Yes.
think say mouthwash, like what you people are giving some mouthwash. Uh, Usually, dentists used to prescribe some mouthwash for clearing all those things.
Yes. Yes.
And then these are some of the things I would like to add to this session.
Sir, there's any advice for regarding the diet for the improving the oral hygiene or health of the tooth? What is your suggestion?
The main thing what we actually tell is like diet is like what we all take. It is a normal carbohydrate and everything. But yes, for children, if we are telling, I always advise my patients that not to give chocolates and sugary products on a regular basis, but to be given as a way to motivate them that what they have done in the whole week. Suppose the parent should tell, if you behave properly in the entire week, you will be given chocolate in the weekend. So they are not daily consuming chocolates and all. So like that, they can actually prevent caries. Next is the xylitol chocolates are available. Xylitol chewing gums are available, which are less caries prone. So even adults are also advised. Even in adults, we see a lot of caries in the entire mouth, even in the front teeth also. It looks very bad. So when they come for a consultation, they come for this thing. Usually they go for restorations and root canals and caps. It becomes very costly for them. So we generally advise for everyone that sugary products should be taken in caution, and it should be you should go for a regular toothbrushing twice a day after meals, like getting up in the morning and rinsing the oral cavity properly with the finger, or however having the breakfast and then brushing and then go to the work, so that you get a 12-hour protection from the from the brushing, because plaque takes almost 12 hours to form. So thing is like, if you brush the teeth and if you do the breakfast and go to the work, that means there is no work. Actually, that brushing is just to mentally satisfy us. For the night, again after dinner, we have to brush and then we have to go for sleep. No more food or anything after brushing. So these are the few lifestyle modifications that we have to do for oral cavity, this thing. And obviously for the adults, we have to see whether there is gastritis or not, because even gastric erosions also leads to the thinning of the enamel. That also leads to the erosions and all. So that we have to look on patients to patients on what exactly how they maintain their life.
If anyone want to have a question, somebody has raised the hand, but I couldn't.
No, no, no. That is the next program.
Okay, sir.
Okay.
Okay. Anyway, we are very lucky to have such a MDS doctor from dentistry came over here and made such a brilliant session, and we
Thank you
really
so much. Thank
was
you so
really
much.
enjoyed, because this kind of presentation will definitely uh, help us to know what is what, and and we can also get an opportunity to clear our doubts also.
Thank you. Thank you.
Some people used to believe that morning toothpick brushing is enough, but frankly, even you miss the morning brushing, you definitely should have a night brushing even after
Yeah.
food. And that's the best thing to protect your teeth.
Yes.
Am I
Yes.
right?
Yes. Yes. Correct. Correct.
And people used to do all this thing every morning, but they never try to do this thing in the night.
Yes.
Anyway, I invite Dr. Ram Paresh sir to say a word of thanks to the session.
Thank you, Dr. Banerjee, and congratulations, Dr. ABHISHEK Banerjee.
Thank you so much. Thank you.
Very nice presentation and informative case presentation and knowledgeable presentation.
Thank you, sir.
Very good presentation of cavity and dentist diseases, role of allopathic and role of surgery and homeopathic.
Yes,
So
yes.
some cases role of homeopathic medicine is a very good
Yes,
and
yes.
advice prevention of better than cure.
Yes, yes,
Not,
always. हम लोग जानते
तो
नहीं हैं होम्योपैथी के बारे में, मतलब इसका मतलब ये नहीं कि कुछ है नहीं, वो अलग ही अपना सिस्टम है, टोटल अलग सिस्टम है, तो वही जानने से वो बहुत अच्छा होगा.
homeopathic is a very good remedy for angle of treatment of some cases symptomological angle,
Yes,
aggravation and amelioration, then cure the patient and mental symptoms. So very thanks,
Thank you,
Dr.
sir.
Banerjee ji,
Thank you, sir.
behalf of IFPH whole team.
Thank you. Thank you.
Very thanks again presentation.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, Dr. Ram Paresh sir. And it's we are very happy to say thanks to those who attended the session also. And once again, I'm thanking Dr. Abhishek Banerjee as well as our partner, Dr. Partha Chakrabarti, for bringing such a brilliant personality to our forum. Thank you once again to all.
Thank you, sir.
Tomorrow we will have a session from Dr. Ashutosh Bhardraj, and Dr. will be talking about Code of Ethics and Registration Regulation of NCH as an expert member of BIRTH. With that, we come to the end of the day 1475. Thank you all.
Thank you, sir.
It's over to Dr. Manoj to moderate the Malayalam session.
നന്ദി ധനേഷ്. എല്ലാവർക്കും നമസ്കാരം. IFPH 1476 ദിവസത്തെ മലയാള വിഭാഗത്തിലേക്ക് സ്വാഗതം. ആദ്യമായി ഒരു നിമിഷത്തെ മൗന പ്രാർത്ഥന.